Fantastic. So it's 1 o'clock. We'll kick it off here today, and greatly appreciate our esteemed panelists who I'll introduce shortly, but certainly the members of the galley and the attendees for joining us today on this exciting topic around utilizing a digital front door in patient care. The term digital front door, which we'll get into in a little bit, has become more important than ever during this pandemic, and we're going to dive into a conversation around a lot of the details and the nuances of this technology that's helped virtualize healthcare during the pandemic. My name is Stan Kichnowski. I'm chair of HitLab, one of the world's leading digital health efficacy testing labs located in New York City and New Delhi. I'm also the director of the Columbia Business School Executive Education Digital Health Certification Program, offering 4 different types of certification in digital health strategy, investing, therapeutics, and health data sciences. And today we have this topic around the digital front door brought to us by Persistent Systems as a way to understand and better understand the first point of contact between a provider and a patient, and how important that is within the front line of care today. The COVID era has driven this need to transform this initial point of contact with virtual platforms now more than ever. And it's really important that leading health systems, which are driving this transformation and are utilizing these platforms, have a better and a greater understanding of this technology. Many of them have adopted it, some of them have not. And so this kind of digital strategy for outpatient pediatric offerings and settings and offices has been one of the high growth areas. Again, we've seen the spread of coronavirus within the pediatric population, families, extended families also susceptible as these spreads have gone on now into the second big wave. We've had numerous waves over around the world, but particularly here in the United States. And this idea of moving rapidly toward a digital front door not only empowers patients and their caregivers and their parents and their loved ones to use this mechanism for care, but it also allows for providers to optimize how they deliver the care. Clearly, the diffusion of reimbursement schemes has vastly increased over the last 10 months. It's not perfect. There's a lot of optimization still occurring there in this constrained health market, but the data-driven solutions that have been developed over the last 10 months to give providers these tools to improve patient, not just entry and admission, but also understanding and guiding patients and providers through a variety of early care management decisions. And I think that's really where this comes as an opportunity to not just digitize that front door, but use that front door as an entree into many other options for this program and for these technologies. Joining me today are 4 extraordinary leaders in this digital front door effort in the digitization and the virtualization of the healthcare system. I'd like to introduce first Dr. Stephen Garcia, who will, Steve, if you could give a little bit of background on your own, from yourself about your bio and your background as well, please.
Sure, thanks for having me today, Stan. I really appreciate it. So I am currently the Chief Information Officer for Children's Hospital Los Angeles, and I've been at CHLA a total of 10 years. And before that, I spent a lot of time on the outsourcing side. So I was with Computer Sciences Corporation and Perot Systems. And that area really gave me a lot of insight into the technology within hospitals. So I have been a CIO for hospitals for that 15 years. And I have also spent 5 years on the adult side and worked with Epic, Cerner, and most of the major EHRs. But I am at the best hospital in the world right now. No offense to all of our other panelists, but Children's Hospital is one of the best in the world, and very proud and honored to work there. Thanks for having me.
Okay, that's outstanding. So Steve's kicking off with some trash talking. Love it, Steve. Outstanding. Let the debates begin. I'll have to carry the flag for New York Presbyterian and Columbia Medical Center. Daniel Barty and Tim Crummins and the crew would not forgive me if I didn't. But certainly, I think in the argument for best hospital in the world would be where our next guest is from, Dr. Christy Vo, from the Children's Hospital of Philadelphia. Again, leading up the telehealth program there. Christy, could you give us a little bit of background?
Yes, thank you for having me, and I agree. We will definitely compete with LA in that regards. My name is Christy Lanchi-Vo. I am the medical director of telehealth at the Children's Hospital of Philadelphia. I'm also a digital health researcher focused on how to integrate technology in our clinical processes. And as academic, I have to disclose that I do have a grant funding from Teleo.org Impact Fund whenever I speak. And I'm excited for this conversation.
And we are too. Thanks, Christy. And next up is the medical director for innovation at Salesforce, Dr. Sam Bhatia. Sam, a few words about yourself.
Yeah, thanks, Dan. Dr. Sam Bhatia. I am medical director of innovation at Salesforce. Prior to Salesforce, I was director of lab automation and a physician solution executive in the EHR world at Cerner. And I do have to claim, although Salesforce is not a hospital, it is one of the top healthcare organizations out there, and we're really moving. So I can't compete with LA, but we are just doing great things in this space. So thanks for having me today.
Yeah, no, thanks for joining us again. And it is extraordinary to see how the virtualization of healthcare has really you look at the legacy systems, the systems that are out there that have been widely diffused, like Salesforce and certainly Zoom and Google and so many others, Microsoft, and just seeing the growth rate and the dependence of the healthcare system for those systems that have been tried and true and implemented today already. So many thanks for joining us here and representing a major ecosystem stakeholder in Salesforce. And certainly last but not least, we have Dr. Suad Trawal joining us from Persistent Systems. He's the technology and product strategy leader in Persistent. And Suad, could you give us a little bit of your background?
Yes, we are certainly not the least. We are sort of in between everybody. And so if you want a fair and honest opinion about what's happening, we are the folks to come to. So I started out as a clinician many years ago, working in a highly technical field of reproductive technology, gone on to operate businesses both regionally, nationally, and in international joint venture before joining Persistent Systems and basically distilling out all that industry knowledge into figuring out how we can bring more capabilities to the hospital and health systems through offerings and partnerships which span academic medical systems, technology vendors, as well as life sciences companies.
That's fantastic and welcome. And certainly Persistent has been one of those tried and true solutions providers in the healthcare system over the last 30 years. And now that everyone's virtualizing at a rampant pace, one of the folks that people can really rely upon to help get things done and make sure things are done properly on time, on budget, which everyone likes to see these days, considering the compressed timelines. Let's kick off some questions. And again, if you're listening online, please do in the panel, in the gallery, if you could ask the panel questions via the chat room. Again, as the moderator, I'd love to see active sessions. I think our record is about 37 or 38 questions. So let's see if the attendees of today's session can break that record. We've got about 15 minutes. So I think you're up to it, guys. So really, to jump into the digital front door and to start to understand it from at least a 30,000-foot level, let's better understand what some of the benefits are and how it's really affecting the physician-patient relationship. And maybe Dr. Garcia and Dr. Vo, you guys can start this off. But really, what is the digital front door, and how is this construct empowering both patients as well as their parents and their caregivers to help be more involved in better healthcare outcomes?
Thanks. I'll kick off. So I see this as just an extension of all the technologies that have been out there before in different industries. Healthcare is caught up, so are catching up. And what we are finding is that I think everyone knows if you have all of your information in one location and accessible at any point or any time, as long as you have an internet connection, it's the best thing for your patients and their families. We found that to be the case, and we've been implementing over the last 10 years the digitization of all of our records across our EHRs. And the biggest piece of that is the integration of all these different systems that we've had. So in the past, when we started moving towards a more digital back end, we had to consolidate all these different systems that are out there. And so we've done that, and for our hospital, we use Cerner as our EHR provider. And they've done a good job over the last several years. And they've also partnered with the likes of Salesforce, so we have great representation here today. And being able to do that has really opened the door for that our patients and families can utilize. And so anything from allergy checking to immunizations to your medical history to billing to scheduling, it's all there now and available, which we didn't have in the past, and that has helped tremendously for our patients and families. And it really is, at a pediatric hospital, a little different. You have your patient, who's the child, and then you have the family that takes care of them. It's not always the parents. So you have to go through, and we'll talk about this a little bit more later, but go through all the processes and make sure that everything is solidified, not only integrated, but solidified for the patients and their families.
That's a great kickoff. And yeah, please, Dr. Vo, can you add on to that?
Yes, I think when it comes to a digital front door solution, when you're built and you're designing it, I think you have to consider a bit beyond the EHR and a bit beyond the MyChop app, or for us, it's MyChop app that is associated with the EHR for the patient. It can, the scheduling, the appointment setting can definitely be on that app, but I think I kind of challenge our own hospital to look beyond that, and how can we reach patients at the point of their mobile phone, and how can we outreach them through texting or through other ways beyond the app. And I think when we do that, we give the patient and their caregiver autonomy and flexibility, because even I, as a user of healthcare, I have my own app that I have to use for my hospital care, and I barely log in. I just, and so I think that we need to kind of think about user experience and think a little bit about how can we design a system that complement what we currently have.
Stan, on your mute.
You're on mute, Stan.
Thank you, guys. We already have questions coming in from the galley, coming in from the audience. And the first one is about how you all see telehealth evolving, particularly amongst this environment we're seeing now, wave 2, we're anticipating potentially even more waves. And what are going to be some of the key differentiators for telehealth as it continues to evolve during the pandemic. And Sam, we'll run this to you and some of the things that you guys are doing at Salesforce, and certainly, so I would love to hear from you as well.
Yeah, I think Dr. Vo and Garski, brought up some great points, especially for pediatric care. We're talking about multiple people taking care of children in this sector of healthcare. So having that user experience appeal to each one of those end users, even the children, is going to be important here for that digital front door. As in order for telemedicine to be successful, that component of engaging the patient and the extended family is going to be critical for effective care. I would go as far as to say that I believe that every patient should be seen digital first. And what that means is that, they're coming in through the digital front door into the telehealth arena and then seeing their provider before they're even brought in.
And that goes perfectly into our another question coming up. And I think this group of attendees wants to beat the record of 37 questions asked. So let's see what happens here. Sage is asking a question around developing scalable telehealth solutions and what that looks like for medium-sized practices. So maybe not your mega hospitals or your mega single group IDs, but when you've got a a medium-sized practice, how does a practice like that develop scalable telehealth solutions? And so this might be a good question for you, since you've been in the trenches building and implementing these things over the last few years.
Yeah, we have gained an enormous amount of experience, right? And that has sort of accelerated over the last few months. I think one of the ways to kind of look at this, if there's one metric that sort of encapsulates, for whether it's for the big system or for the small system, if there's one metric that encapsulates the patient side, which is the satisfaction, the experience, and on the other side, it encapsulates to the structure and the resource requirements to make it happen, it's the patient waiting time, right? And how that works is, on the patient side, it brings a lot of convenience if you have shorter waiting times, but and flexibility, right? In order to make it possible for somebody to visit or meet the doctor at their convenience, at their time. It might be after hours. But in order to give that kind of flexibility and that kind of on-demand capability, we also see that on the provider side, it's got to be resourced and structured to do that. So you can't have you can't really fix a webcam on a brick and mortar practice and provide the same type of digital consumer level experience that patients are experiencing in other fields of life, right? And a simple example, I can take an industry that has been very, very mature in how to respond to consumers. And over the last few months, if you look at the fast food industry, it's possible to do the order and pickup of food, right? And I did that with 2 different people, almost same time, same day. One of them gave me the pickup order in 5 minutes. One of them gave me in 45 minutes, right? And that's how inefficient the process was. So a lot of hospitals will have to structure, optimize a lot of the deeper processes besides the surface webcam, if you can call it, right? There's more than the webcam involved. Sam, maybe you might have some to add to small practices.
Yeah, I think the good news is that, I think it's something like 70% of the consumers out there want a mobile experience. So simply by using a mobile device, because CMS has lifted all those guidelines on, the solutionings or the platforms that are HIPAA compliant. So simply using FaceTime will work. But, we've even seen, especially with children, they're getting on the phone. They're more compliant than their parents right now. So I think it's a little bit easier in some regards with children and using a digital platform. I would throw this out to the other doctors too and see what your thoughts are.
So yeah, I have a bit of experience with medium to small size, primarily clinics in the Pacific Northwest. And what we did is, because the cost of having a full EHR like a Cerner or an Epic is so high, and it was very difficult for them to be able to attain, we started provisioning. And within our hospital system, we provisioned out to those clinics in smaller locations, and it was a big success. So that helped defer some of the costs, and legally you can do 85%, you can pay for 85% of the cost for those sites, and they don't have to necessarily be affiliated, but it also helps build the network. So since the EHRs have advanced so much over the years, I think it's difficult to have your own EHR as a smaller site or clinic. So provisioning has been a big success for us.
Yeah.
Yes, and I'd like to add on to that, there are solutions out there that are working to provide that digital front door for a moderate sized clinic as even the sole provider. I actually know of a startup called Orchid, like the flower, that is designing such a solution that fit the need of small to medium sized clinics and provider.
That's fantastic. And maybe Christy, you can take a question from Kirsty. So Kirsty wants a question, and she wants to know, how would you distinguish the digital front door from a traditional patient portal or PHR?
So the traditional patient portal have components of the digital front door. Like they have the easy scheduling, they have the patient instruction, right? That is pinged to them, and they have the messaging with their provider. So those are, I would say, consider the digital front door features. And then if you add on top of it, if you extend that by automatic text reminder to the patient mobile, or even sending the patient education directly to their phone so they can click on a link and come up the patient instruction instead of them have to log in into the EHR or the patient portal. There's a lot of creative solution and creative out of the box thinking that we can use technology that are currently existing to facilitate even closer to the patient point of touch, their main point of touch for healthcare.
And if I could add on to that, Stan.
Yeah, please.
So very similar to what Christy and her teams have done, we built that overlay app that allows us to utilize other resources. So Ease is an example, and that's a software package that allows parents when their children are in surgeries to be able to view the child and text with the physicians and even take videos and pictures during that time. It's all secure. And so that was not integrated into Cerner. And so what we did with that overlay application, it's called Children's LA app, and that is easier for us in the technical back end to be able to integrate those applications. So we've done that with multiple applications, and it gives you that digital front door with everything included, as Christy stated.
Love it. And while you're speaking, Stephen, maybe we could talk a little bit about another question from the galley is around this, the digital front door and how it meets multicultural needs, different languages, different ethnicities, all within the Los Angeles Basin area and beyond. How does your digital front door program and effort reflect that?
So one of our major challenges is associated with all the different languages that we have here. So we have 64 different languages that we are up against in our area. And we love the different cultural backgrounds of everyone. So we want to try to be able to serve them all. Unfortunately, Cerner really only manages a few of those languages. So again, with that overlaid app, we've integrated in a few different solutions to be able to translate. And we have our translation services that are connected in through this app now. So you can press a button and be able to get translation services live, just like you would for telehealth or telemed visit, and have that translated through. So there's a lot of different opportunities there.
That's fantastic. And Dr. Badia and Dr. Throttle, any other inputs on that you guys have done in your implementations and for culturally diverse neighborhoods and cities?
Yeah, it's about, our innovations have been about wrapping around the existing patient portal and creating a hyper personalized journey that we've been utilizing in the other sectors of the market, in more of the consumer market. So again, being able to relate and communicate to whether it's an adult, whether it's a child, or someone from a different country, we have the ability to understand where that person is coming from and then deliver the right content in the right language to the right person.
If I may just add, so the way we would, I think the way the digital front door is evolving, it certainly starts off as a wrapper around the portal, right? Additional services. But I think a way to frame the whole thing is, think of each of these touch points as channels, right? You may have something for texting, you may have something for on the web, you may have something on a mobile app, and you might have something on an Alexa or a Siri. Each of these are channels. And then sort of the front door also applies to the provider network that basically wants to refer patients. So the way the design choices that we make are, what is the yield in those channels, right? Is there underutilization or overutilization, patient safety issues that need to be considered, liability issues need to be considered. As an example, if somebody is responding to a phone call and they need to make some decisions about routing or triaging, what kind of logic or decision tools are they using? So the yield is one point. The number of channels is another dimension of how to extend what that digital front door is. And then you kind of enrich these channels with data that comes in, either, as Sam mentioned, personalization that tells what kind of responses or content are to be presented or how to respond to this patient. the EHR data that gives a whole lot of background in terms of just knowing what's been happening with this patient. Then I would also top this off with an additional layer of, after these events and these sessions, you also need to collect feedback. You need to have a follow-up, close the loop mechanisms, and you need to be able to reach out to them so that this is sort of a a virtuous cycle of more appropriate care to the larger population.
That's perfect. Anyone else want to add to that? We have questions streaming in here from the audience, and I think they're going for the record of breaking 37 questions in an hour. But we have this from Ravi, and this will be a toss-up, so whoever wants it can jump into it first. Have you seen the return on investment analysis to define the impact of the digital front door, given that it integrates into many operational areas of a system?
Yeah, I can take that one. We see pretty quick ROIs because, in healthcare, we're always constantly doing workarounds. So if you can take 10 steps and convert it into 5 steps in any one of these processes, whether it goes into the physician or the clinical workflow, if we could remove steps there. But then also on the other end of the spectrum, capturing patients, bringing them in, engaging them, and bringing them in digitally instead of that traditional mechanism of brick and mortar. So we're seeing very strong ROIs, generally less than a year.
Yeah, and you could take certain, if you break down certain channels. So for example, I believe in a lot of the pediatric hospitals that we worked in, there's one of the key channels are, of course, external providers who are referring patients to the hospital. And this is something that is a broken process, or in any situation, we can definitely see a nice improvement in yield of at least 10 to 15%. And that's not even using any advanced technologies like AI or anything, but just purely automating that process, making it possible for these external providers more easily to refer, and also to get back information about what's been happening to that referred patient. So that's clearly one channel where ROI has been repeated across in many different hospital systems. And I'm sure we'll see that appearing in all the new channels as we deploy and test them.
Yes, I'd like to add to that because it's actually part of my research. Currently, behavioral health is pretty siloed from the rest of medicine, and even our own pediatrician colleagues can't refer to mental health seamlessly. And so, part of my research is to look at how mental health screening in pediatric population can and linking them with care coordination and referral processes that are connected to each other, and also streamline the processes of connecting with the parents, following up with them. Do you call to get an appointment? What are the barriers? And by doing that, I think, as you mentioned, I think we would definitely, one, increase the capacity, the fill capacity of our provider on their schedule, increase their fill rate, and in essence, drive revenue. And so that's what we're trying to do as part of my development and research.
Okay, great. We've got a question from Aaron, which I guess from reported by Dr. Garcia, his hospital being the best in the world, I think. I'm sure he'll have an answer for this one. But how do you build consensus across the organization so that all service lines can operate similarly, so that patients and the parents have similar experiences across service lines, i.e. communication and scheduling, other things like that? How did you guys do that at Children's?
So this has been a long process. We've implemented our EHR, gosh, I think over 20 years ago now. And in the beginning, especially in the last 10 years, we've consolidated a lot of the standalone applications that were in a lot of the departments. And if we couldn't standardize those on the EHR, then we would integrate those into the EHR. And by doing that, it really provided us the best tool to be able to standardize across the organization. So I think you're hinting on some of the challenges that we face on a regular basis, especially as a CIO, where we have different departments that want different things. And you can always find an application, standalone application that may be better than your EHR. It's just because the EHR may not have as much functionality as those applications. And so those departments want it. You have to consistently push for a standard across all of your organization in order to standardize for your patients and families.
Anyone want to add to that? Dr. Badia, Dr. Waddle?
Yes, Sam?
Yeah, go ahead.
Okay, so I think this, you know, it's a very human system, a hospital system, and you have these different solutions that are being, you know, coming in, point solutions that you eventually have to integrate. I think over time, you know, I guess the EMR did not have a problem of, also had a problem of multiple EMRs, but that's largely solved in some sense. You have, you turn over to an EMR and you solve that. Now, in terms of these solutions that, in terms of the digital layer, there's a choice you have to make, I guess. You can always go to a number of point solutions and then figure out the integrations and the complexity of managing them, owning them over a period of years. Or the other strategy to take is, you know, in that digital layer, are you willing to consider a sort of a 70-30? If you think a large landscape of that digital layer can be handled by a particular platform, you might as well centralize your efforts around that. And then, of course, a platform or particular technology is not going to solve everything. You're still going to have to go into some of those beautifully, perfectly designed point solutions. But I think that 70-30 rule about the digital layer would turn out more beneficial over the long term.
Yeah, and if I would give, just to add on to that, if I'd give advice to an organization right now, I would say start in the contact center or the call center. That will help you standardize some of those upfront processes. The second thing I would say is land on an enterprise-wide strategy for your engagement platform. And then third thing, which is obvious, is make sure you have all those points of integration.
That's fantastic. And you know, again, I think these issues are complex, and oftentimes the data coming in to folks like yourselves who are implementing these sorts of technologies on the front end of the patient care system are getting a lot of contradictory and overwhelming data. So it's by no means an easy task. Speaking of easy task, the 11/12/2020 webinar cohort, all you attendees listening, we need more questions from you all. You guys are only up to 12 questions, and the record-setting 37 questions I think is safe right now. Given that we're at the halfway mark. However, we do have one attendee, Sage, is really putting the whole team on her shoulders and trying to carry this record. Sage has asked another question, and again, we'll go back to you just in terms of how it looks on my Zoom wheel here in front of you. So Dr. Garcia, we'll put this one on your plate for now. Then everyone else please add in. But Sage is asking about user experience, and she wants to know, user experience is as important for the parents of patients as well as the patients themselves. How are Salesforce, Persistent, CHOP, obviously children's, dealing with this two-pronged end user challenge?
So, and this is a great question for Persistence and Salesforce. It's, from my perspective, is to ensure that we're utilizing the best information first and foremost, which I alluded to earlier, but also gaining and utilizing these other applications that are available to provide that full digital experience, not just the basics. You don't want just to be able to do the billing and scheduling. We have a symptom checker in our app. We have various other pieces, as I mentioned earlier, through the Ease app. And we also use Salesforce for different parts. So we want to utilize all these different aspects that are available out there for that full experience, like you would at an Amazon or something else.
I can add to that. In terms of the user experience, I think it's important to think about the consumer and the patient, and also the provider user experience. And a lot of times provider are overwhelmed and overburdened with administrative tasks. So as in designing a solution, we have to definitely talk to the provider to understand their pain points and produce a solution that solves their pain point and not add on to their pain point. And for example, one solution for payment processing is you have to consider, do I really need to get the patient credit card? And I'm mainly referring to the sole provider or the minimum-sized clinic here. But like, how can I make that automated? Those are the questions that you should think about and eliminate some of these things where it adds up at the end of the day. And so I just want to add that for a bit.
Yeah, and
I love this.
Okay,
I'll go this time. I love this. This is about innovation right here. And so I was talking with one of my colleagues yesterday, and we were thinking, why don't we create Salesforce for kids? Why don't we create a user experience for kids? Because, you know, given the circumstances right now. And so specifically right now, what we're doing is we have a platform where we're allowing the schools, the parents and caregivers, and the healthcare organization to communicate on one standardized platform. So given, you know, the circumstances with schools right now, they're open, they're closed, they're hybrid models. This has been invaluable for some of our clients.
And if I may add, so the way we think about it is it starts with design, right? So we design for, as I said previously, waiting time. We design for patient safety. We design for avoiding disparities. So I'll just give you examples. So in terms of patient safety, so in terms of whatever touch points that people land in, we have chatbots and triaging solutions that are available, whether it's on the web, it's on the phone, or even the contact center or others. But when we think a little bit deeper about designing for the proliferating number of use cases, our R&D team focuses on not just the chatbot technology, but when we're thinking about healthcare, as an example, in a chatbot, what happens if the chatbot goes down a path where it should not be going, right? Or a child or teenager is expressing some things with the chatbot that he or she is assuming that a provider is going to know about it, but it is something really important. Maybe it's a suicidal tendency, and other ways to capture that, making sure that that is captured. So designing for patient safety, number one, designing for waiting time, as we spoke about earlier. And then lastly, I'll talk about disparity. We can give a lot of technology. And so that's why when we think about, we should think about programs, not solutions. So you could potentially have a very sophisticated remote monitoring care program, but you might find a large population segment of your population does not have a smartphone or the ability to afford those devices. So when you think about putting in a platform for the program, you think about those segments too, and make sure that you have processes and workflows that would sort of fill that gap. So if they don't have a device, they don't have a smartphone, you actually have a process where a coach is more frequently checking in with them with their results and all of those things. So there's a number of ways we would think about it, but that's how we look at user experience.
Yeah, and I would just add that one of the big successes that we've had within our app is the COVID pre-screen or screening app, and we actually just utilize some chatbot functionality for that. And now we're rolling it out to the local schools out here. The team's done just a fabulous job to be able to make this available to the county. And that has driven a lot of patients and their families to our app, which is exactly what we're trying to do.
That's brilliant. Yeah, that certainly, I think every school system in the country would want to hear about that. Yeah, Dr. Vo.
So, yeah, I also like to add in terms of user experiences to think about the searching for care process. I think people only think about the setting the appointment and beyond, but the searching for care is also important to take into consideration. For example, for mental health, if you've ever tried to find a mental health appointment or a provider, it's tough. You have those phone tags, you have to call. No therapists or psychiatrists really have an easy way to schedule with them on their website. And all that is troublesome for the patient, but it also is troublesome for the provider in the sense that patient will go to the next one. If they don't have an easy way to schedule on their website, the patient will just go to the next one. where it's easier for them to get. And I think that that's something for provider and small clinics to consider, because I think if you don't get ahead of the technology, then you're being eaten in a way. And I think that's important to know. How do people search for care, and how can I be at the forefront of whenever they search, whenever they find care, I'm there.
Yeah, I think that's really a good way of looking at this. And we've got another question coming in around and again, hats off to our Sage. She is trying to just absolutely kill the record. She's got 3 questions in already, so she's knocking it out of the park here. Here's an interesting question for 2021 and the future of telemedicine for next year, even just going in the next several months down the line. And again, we'll take it to the top of the screen as I see it, and Dr. Garcia. But how do you see the digital front door evolving through the next 12 months versus face-to-face? Is this something that you see now as being a permanent fixture in your healthcare system, or is this a temporary fixture and you plan on reverting back to what you were doing 12 months ago, hopefully within the next 12 months as the pandemic subsides?
That's a great question. So I would say that what was fascinating to see is that we had our telemedicine program and foundation in place on the technical side well before COVID hit. We were averaging about 100 telemedicine visits a month. When COVID hit, we were able to switch over rapidly, and all we had to do was train the physicians and the nurses to be able to utilize the system. And once we did, we were averaging over 50,000 visits per month. And it was amazing to see how quickly people adapted. This is here to stay. There's no doubt in my mind. It's just a matter of how much. We have seen a drop, a shift back to patients coming back on site. And so we're at approximately 20% of our visits are now telemed visits. But that is, I think, going to stabilize and stay. There's no doubt it's going to stay. And I think with more functionality coming in the future than, for example, wearables, we'll definitely be able to utilize that more in the future. A big piece of this, though, is the fundamental question of how much do you get reimbursed for a telemed visit. And so, fortunately, through some of the congressional acts, we've been able to see more reimbursement, but it's still not at the same levels that we saw if someone were to come in. So that is a challenge that we have.
And Dr. Bo, is that about the same outlook that you guys are looking at as well?
Yes, so we definitely think it's here to stay in regards to our own department, psychiatry and behavioral sciences. I lead the telehealth team there, so when COVID happened, we already had the framework from the year prior of how to ramp up, and we use that framework to ramp up, and we actually have 233 staff just in our department. We converted everybody. We had an online training already done, and so it's quite remarkable that even those who were against it really picked it up out of necessity, and then they end up enjoying it. Furthermore, from our data, we actually saw that in the same time frame between April to July of this year, we had more patient encounter completed than we did in 2019. And patients are able to schedule an appointment within 7 days. And that's compared to months before when people were playing phone tag. So I think eliminating phone tag is so crucial, and as well as being able to have an efficient processes to schedule a patient is so important.
Absolutely. And let Dr. Badia and Dr. Tawada love to hear your perspectives on this too. But just in case people don't have their questions answered, everyone here uses LinkedIn, and please do link in with them or myself or whomever for more questions or more information about this topic. Obviously, it's a critical topic in today's healthcare ecosystem. And Dr. Badia, what are you all seeing, and what are you all anticipating, given the fact that you've got dozens of implementations around the country, and you're probably seeing different people strategize different things over the next year or two, and what they're planning to do, whether they're planning to keep the digital front doors out there or pull it back as the pandemic subsides?
Yeah, we're seeing everyone is looking to invest in the digital front door and less in buying brick and mortar or buildings right now. And secondly, we believe it's here to stay, without a doubt. And lastly, you know, it has a direct correlation with that reimbursement component.
It's fantastic. And yeah.
I think the health systems are doing the right thing right now, responding, adapting their systems to the new demand that they've seen. But the bigger picture for them is really something to keep in mind. There's just this year, $12 billion of investment into digital health. And that's beaten all further records, right? And you see the number of IPOs that have gone. And you see, for example, Amwell just announced his IPO. What I think is the health systems have to think about where these utilization is going to be drifting away from them, slowly towards other entities in the market. And of course, the biggest competitor are going to be the Teledocs and the Amwells. That's one side of the things. So I think health systems have to take the long view. And the long view is probably not just retrofitting and adapting, but really creating telehealth service lines that have the same kind of operating margins and cost structures that can compete on price and capabilities with all these other entities that are in the market. And that would take a significant leap from mere adaptation to the immediate and short or medium term.
Brilliant. Absolutely. Yeah.
Actually, with that being said, I do want to point out the point of reimbursement, right? So when it comes to reimbursement, there are states that don't even have parity issues, like Texas. Like Pennsylvania. Texas actually do have parity laws regarding, but Pennsylvania don't have any policy in which they require payers to pay for telehealth services. So we're actually at a big risk of not getting reimbursed. So I kind of want to ask the panel, I mean, is your company involved in advocacy? Are you providing data and collaborating with academia to present it to payers and policymakers to adapt and change? One of the things I'm involved with is with the American Telemedicine Association. And we have a good cohort of many clinician, academic, and industry as well. And the work group is on telehealth data-driven value proposition is our name. And we are actually looking for data in terms of reimbursement to use in lobbying effort. And if anyone listening would like to provide the data that they have, maybe at LA, maybe at other hospitals, and I think we can work together in advocating for policy that benefits you know, the new frontier of patient care, as well as ultimately help the patient good clinical care and outcomes.
We've done a lot of advocacy to make sure that we can get as much of the reimbursement that we can through telehealth. There's basically no option. We just cannot afford to have our children not see a doctor, whether it be telehealth or on-site. And so making sure that the physicians and the organizations, the hospitals are reimbursed is absolutely critical, so you can count us in.
Yeah, we believe in equality for all. So removing any barriers that create discrepancies or social barriers is going to be an issue. So equality is key here. Actually, one of the core principles of Salesforce as well.
Fantastic. There's another question that came in through the audience around ROI, and everyone knows how resource constrained things are right now with the pandemic, curtailing a lot of surgeries, a lot of different sessions and different labs and tests and whatnot. So in general, healthcare providers are hurting. And Dr. Garcia, and then I'll go around the room, the virtual room here on Zoom again. What do you traditionally look for in terms of an ROI cycle time? Is it a kind of equation where it's got to be within 6 months, 12 months, 18 months? What does Children's look for when someone is coming in and proposing a digital health solution for your institution?
Usually for digital health, it's a relatively short turnaround is what we look for as far as ROI timelines. But that being said, We also know that this is part of our strategic initiative. So when we are looking at part of our strategy, which our wonderful Chief Strategy Officer, Laura Curry, has pulled together with our teams, we have one area that we're really pushing for, which is called Impress, and that is really that digital front door is a big piece of that Impress piece of the strategy. And so making sure that we meet our strategic needs really drives what the other panelists stated earlier, are those referrals and how you're able to track those, and building that community out there through your network is really critical. So a lot of that is very hard to measure, although we do track our referrals and we do see how they're increasing or decreasing. It is still very hard to track. And what we're trying to do is make sure that our market share of all the kids go to our hospital in the county and beyond really is what we track. But again, it's very hard to measure. So there's not necessarily always an ROI that's measurable within that time frame.
And Dr. Vo.
Yes, so part of my research is actually based on suicide risk screening and triaging them to low, moderate, high, and then sending them to appropriate level of care at the appropriate time, whether that is referring to an outpatient therapist or doing it in the visit, point of care telehealth visit with the consultative psychiatrist. And I bring that up because like Dr. Garcia said, we don't know what happened after a kid is screened suicide and they don't have to go to ER. What happened to them? Did they really follow up with the list that the pediatrician gives them to call? And so that's why we really want to collect those data and really want to understand how do people access care, even when they're in a crucial point, you know, with suicide risk. And I think a lot of times payer, particularly, they don't understand the complexity, so they just think ROI, but think about like the cost saved from a patient not having to be sent to the ER, or the costs saved that they don't have to pay for extensive outpatient services and just regular outpatient services. And cost saving is harder to calculate, or like diverting from high level care is harder to calculate.
Absolutely. And again, staying within the horn here on my Zoom screen, Dr. Badia, what are you seeing hospitals and clinics, certainly the bigger clinics as well, needing in terms of ROI timeframes when they're looking for new solutions like digital front door?
Yeah, this is interesting because it does require data. So you need to look at the data. It's coming in from all sources, but the key with all the data, in my mind, is having a command center, having a heads-up display, and taking all that data and making sure that you can make the right decisions off of that data. So that's where your ROI comes into play. You know, in particular with children, nutrition, obesity, following that child along the care continuum, getting that data in, making sure you're pushing out the right data, and making sure you're making those right decisions and right actions upon that data. But like I stated earlier, generally the ROIs right now are so quick because of the pandemic right now. So we're seeing less than a year easily.
Okay. And then Dr. Throttle, what have you seen in the ecosystem from all of your experiences?
Yeah, I think I kind of would back up what Dr. Garcia and Dr. Vo and Dr. Bardia mentioned. One thing though that I think that health systems need to think about when they make these investments, yes, the ROI in let's say a referral optimization is pretty clear, or at least clearer than in many other things. But if you see, for example, AI, and since we've been involved in a lot of this, there's a lot of dollars going into, even in health systems, especially on the research side, in trying to develop some algorithms, but many of them are not moving into the operations side of the care delivery of that system. And I think the problem is developing an algorithm, optimizing it, monitoring, managing it, putting it in an operation is far greater cost than the initial run of finding a a high positive predictive value with the algorithm. That's just part of it, right? So I think I would really think that the health systems, if they really want to see an ROI in these investments, they've got to partner with industry who can distribute that cost in a far larger market than trying to recover that investment in that single hospital. And that's especially true of these high investment AI projects, where it's kind of very difficult for a single health systems to see an ROI. And so much of that research just ends up being published as papers, but not further than that.
I love it. And we've got about 2 minutes left, 2.5, maybe 3 minutes left. And so we'll do a rapid question, roughly 30 seconds, answers from each of you. I think let's go from the ROI to patient outcomes. Let's talk about some of the patient outcomes benefits and some of the efficacy, the healthcare efficacy that we've seen from the digital front door, and what your experiences show there. And again, we'll lead off top of the Zoom screen in front of me here. Dr. Garcia, what have you and children seen?
Yeah, one of the things that we've seen, and real quickly, is really the increased communications between the patients and our staff. So I would say communications, if we try to keep this very quick.
Great. Dr. Vo?
I would say satisfaction. Parents and children are loving the digital front door.
That's impressive. Is that at a high degree, like a 90s degree, or is that like a 60 to 70% degree?
So our press gaining was the highest it's ever been.
Wow.
Historically.
That's
during
impressive.
COVID. Yeah.
All right.
Highest percentage. Yeah.
There you go. You're officially the poster child for the digital front door. Congratulations. Well done. And Dr. Vadia, what have you seen in terms of some of the patient outcomes and improved outcomes for patients in the systems, all the different systems you've worked across the country?
It all starts with engagement. It all starts with patient engagement.
Great. And so the outcome, have you seen like reduced readmissions or reduced, just general like improved SF6, SF12, SF36 scores? What kind of?
Yeah, most of the organizations we're dealing with are at risk. So having that engagement through a population health platform of some sort where you are, as Sawad has talked about, multiple channels, you're communicating with these patients on their preferred channel, whether it's text or email,
right.
and giving them those soft touches that they need, which has in turn reduced readmission and increased revenue for the organization.
I love that. And so I'm imagining, given how much my college senior at Penn State loves TikTok, I'm imagining we'll soon have a digital front door on TikTok, and we'll be doing that as well. Outstanding. And obviously, Dr. Tawad, I'd like to hear what you're thinking and where you're seeing outcomes improved, clinical endpoints improved from this digital front door.
The positive outcome, both in engagement, in utilization, and we're also seeing increasingly how the clinical outcomes are being impacted. What I can just say is that the results have given enough confidence to many of our partners and clients to kind of, further make investments going forward. And that to me is an indication that the data is real and there's a real ROI they expect in the short to medium to long term.
That's fantastic. And, really, really well done. On behalf of the multitude of attendees in the galley, including a shout out to my Rivertown neighbor, who's the head of data visualization for Google Cloud. Thank you everyone for joining. And thank you. I think we're just gonna have to put Beth Herrick on the payroll for asking all the different questions that she was able to ask today. And I'm sorry, Sage Herrick, for asking all the questions that she asked. And that really was wonderful. Again, for the attendees, don't forget next week at 5 p.m. on November 19th, we have another tremendous webinar for oncology and applying the virtualization of care. Joining us will be Dr. Rafael Fonseca, and just a phenomenal panel from the Mayo Clinic, from Massachusetts General Hospital, from Brigham and Women's Hospital. We just have, and then of course, our favorite Dr. Sawat Tawada will be back with us again. if those of you who are on the chat today and the panel today would like to attend, all you have to do is type yes in the chat right now, and we will register you for that event automatically. So again, super excited to have everyone here today. On behalf of Justin Bolova and the HitLab team, on behalf of Persistent and our sponsor for sponsoring this wonderful discussion today, I want to thank everyone for joining us.
Thank you.
Take care and stay safe.